Hey there, Dr. Brian McKay, not just a chiropractor, Stanford, Darien, Norwalk, New Canaan. All right, here's the situation we're going to address today. And it kind of, listen, I'm 62 years old, and if I got to be honest, I think I'm concerned with dementia as you get older. I'm surely not as sharp as I used to be, or at least I admit to myself I'm not as sharp as I used to be. But I really want to talk to you about, you know, people are waiting for the next new miracle drug when it comes to Alzheimer's. You know, Alzheimer's is a form of dementia, but the miracle drug, it's you have to think a lot of the health issues we face today are more about poor lifestyle choices that we make in our lifetimes. I mean, if you're a lifelong smoker or you don't exercise, you eat wrong. There's so many different things that go into um, causing our own worst enemies per se. I think everybody agrees with that for the most part. Can't keep blaming the next guy all the time. So I want to go over is if you're concerned about Alzheimer's, now is the time to do something about it, not when it's too late. And another topic I'll go into another time is the 7 different stages of Alzheimer's. Because once you're in 1, 2, 3, and 4, you have a shot at mitigating it somewhat. Unless you're waiting for that miracle drug. But I'm telling you, it ain't coming anytime soon. I'm sure people are working on it, but there is no one particular miracle drug. But the thing is, if you know you're at risk for it, that's one particular way, because there is the family history. If your grandparents had it, your parents had it, well, and let's call it dementia. Alzheimer's is a form of dementia. But I think it's pretty scary because the amount of money you will spend at the end of your life trying to deal with Alzheimer's, and you won't even be aware of it because, one of the worst things about stage 6 and 7 is you don't think you have a problem. Actually, it's more like five. Stage 5 is when you start to think like, I don't have a problem, but everyone else around you does. And the worst thing is when by the time you're up to stage 6 and you're incontinent, you basically last another 2 years. So you need people feeding you, changing your diapers. The amount of money that costs these days is astronomical. They'll take your house. But anyhow, let's. What I want to approach is there is a test to see if you're at risk, or it helps. It's through a company called Cyrex. Now, of course, you have LabCorp, you have Quest Diagnostics, and they do a decent job. But here's a specific test for Alzheimer's, and it's called a Linx, Linx. Now, I don't make a dime off this. I'm just doing it to educate people because, here's who should take an Alzheimer's Linx test from Cyrex. I mean, if you know of a better one, please call me up. Let me know. I'd love to be able to get that information out to my patients. And so, who's interested in taking this Alzheimer's Linx test? Are you interested in preventing the development of Alzheimer's or other neurological disorders? Okay, because dementia, there's a couple of it's a lot of bad stuff that if you know it's coming, can you change your way? It's like if you know you're going to get lung cancer, you got to stop smoking. We hope, but there's other things that when you identify certain reacting things, that antigens that react to you, and if you can mitigate those and tamp them down, hey, you got a much better shot. So those are the people who are interested in preventing the development of Alzheimer's or other neurological disorders. This is a test for you. Alzheimer's Linx, Linx. Are you exhibiting early stages of Alzheimer's disease or other neurological disorders? Kind of in your best interest. Now, I got to be honest with you. I don't think this is not one of those, things the insurance company's going to cover. Everybody's worried. Do you take my insurance? Is this covered? I don't think so. Have you been diagnosed with Alzheimer's disease? Well, you may want to know if there's stuff you can do besides hoping and praying, or just wait until someone starts changing your diapers and having to feed you. Because chances are it's going to be your loved ones. So once you get to 5 and 6, and you don't know you have a problem, you don't care you have a problem, people around you do. There's another thing here. It's like, may sound strange, but have a history of gastrointestinal disorders and diabetes. The reason these are tied in, and you may want to take an Alzheimer's test is because Alzheimer's is often referred to as diabetes type 3. So it's a lifestyle type of thing. And, you know, the poor insulin resistance is a serious problems. And it kind of leads to like a fatty brain. Your brain gets fat. It can't disperse of the garbage through the microglial cells in the brain. And I'm trying not to overcomplicate the explanation here, but it's just something you should be aware of. Now, here's another one who could benefit potentially. Gastrointestinal disorders. A lot of times, a lot of stuff creeps up from the GI tract, gastrointestinal, aka the GI tract, up to the blood-brain barrier, typically through the vagus nerve. Now, the vagus nerve, if you have, just try to relate this. When Christopher Reeve, Superman, had the accident, was paralyzed, his vagus nerve was still intact, which is why a lot of his ongoing, he couldn't move because of the fracture, but he was able to get a lot of stuff done as well. So let's just suffice to say, there's a connection from the gastrointestinal system, which is a whole nother nervous system unto itself, and that you just have to accept as fact these days. But it can lead to infiltration along the vagus nerve with a type of thing called alpha-synuclei. But I'm trying to keep it a little bit low key to less heavy on the terms. So those are the people. So basically, you're interested in preventing the development of Alzheimer's disease or other neurological disorders. Alzheimer's Linx test from Cyrex. Are you exhibiting early stages of Alzheimer's disease or other neurological disorders? Parkinson's type of diseases, supranuclear palsy. There's a lot of different stuff out there. Have you been diagnosed with Alzheimer's disease? You could benefit from taking the test. You have a history of GI issues or diabetes. Sometimes people have diabetic issues and GI problems. Here's another one too. Played high impact sports. High impact sports are where you're going to get concussions, and that's typically what we're looking at here for the most part. And then why would you benefit from it? It doesn't take long after a head trauma to interrupt the mucosal covering on your intestines that will keep the bad stuff in, and then when the bad stuff leaks out, it's a condition called a leaky gut. And a leaky gut allows all this bad stuff to come out of your intestines into the system, goes up the vagus nerve through the blood-brain barrier. So it's a lot more important than you may think. Just, I had a little concussion when I was younger. The blood-brain barrier is hard to penetrate, but when you have gliadins, which is a breakdown of gluten, and that ties into the gastrointestinal disorders, you can have issues a lot more serious than just having a little head bang, playing, maybe get hit in the head with a lacrosse ball or soccer ball, football. Anyway, any high impact sports where there's head injuries. Car accidents is another way too, I should actually add. So that's who this test is recommended for. Now, also, if you have immunoreactive against specific antigens, chemicals, and foods, this test is for you. Basically, do you value your life enough that you would want to take a test to determine if you're likely to develop Alzheimer's, or if you do have it, what are the areas? So clinically, you would identify that this helps identify the patients who are at greater risk for developing Alzheimer's or other neurological disorders. It's also help to identify reactivity to certain triggers of Alzheimer's disease and other neurological disorders. And it helps to identify early stage of neurodegenerative processes. Another one is it helps to monitor the effectiveness of lifestyle modifications for Alzheimer's and neurological disorders. So, question here is cost. Well, Cyrex will have to tell you that. Or if you want to call me, 203-656-3636. It would behoove you, if you're interested in your own mental health, to do it. It's going to cost money, yes. But at least you can have an idea of what you're up against as you get older, because this is serious stuff. I mean, it really is. So as far as the different, this test is a pretty damn specific thing. So different antigens. There's brain proteins that you got to be aware of. It's kind of like they aggregate. These proteins aggregate, get clumpy. Okay, so when it gets clumpy, it becomes much more difficult to take the garbage out when you need to. I'm talking about tau proteins, amyloid beta peptides, alpha synuclein. Okay. Now, another thing too is it tests. This test will also brain-derived neurotrophic factor (BDNF). This is where you grow nerve cells. Okay, beta nerve growth factor, neurotrophins, somatotrophins. Pretty important. These are good markers to know if you're having issues with those areas. The enteric nerve and vasoactive intestinal peptides, transglutaminases, pathogens, oral pathogens, Enterococcus, Escherichia, Campylobacteria, herpes type 1. These are different pathogens that can contribute to breaking through that blood-brain barrier and causing all kinds of hell. Now, as far as chemicals, mercury, ethyl and methyl mercury is something. Phthalates, what you're going to see when phthalates in a lot of things, but dry cleaning is probably the biggest thing, easiest thing to remember. Aluminums, these are different chemicals. Do you have a propensity to store these in your brain? Good to know. What are you going to do? Well, at least you're going to know you have it. Foods, the foods that you kind of watch out that can be cross-reactive to the amyloid plaques, okay, are egg yolks, believe it or not, lentils, lecithin, pea lectin, tuna fish, hazelnut, scallops, and squid, caseins like milk caseins, alpha gliadin and gliadin toxic peptides, gluten wheat proteins. Those can be reactive with the amyloid beta to kind of make those proteins clump up more. And as far as the, certain kind of blood-brain barrier proteins are also tested. I just went through a whole hell of a lot of this. And it's Alzheimer's associated immune reactivity. And if you can pick out where your problem is before you have the problem, because that's always the best way to nail it. It's like, okay, let's get these tests done. But you're not going to get this test done. I don't think LabCorp or Quest or Yale around here test for this. It's a very specific, very, very specific. So what it's kind of up to you to take this by the take the bull by the horns. It's really not a bad idea to get tested if you can afford it. I know I wanted to get this information out to you because I really what happens is people are just not no one wants to spend the money. I get it. But when memory care places cost, if you found a memory care place around here in Connecticut where we practice, you're talking $14,000, $15,000 a month. Unless you're incredibly wealthy, it's going to be almost impossible to sustain that type of a outlay. Typically what happens is you go broke. They take your house away. If you have a spouse still alive, that when that spouse passes, your estate's gone. So it's kind of, and also too is what about the quality of life? I mean, if you get into stage 7 lasts 2.5 years on average. That's someone who cannot feed themselves. They pee on themselves, they poop on themselves, diapers, round-the-clock care, a lot of family involvement. So if you think about doing it for your loved ones, you're also going to have a much better quality of life because there are things you can do to, once you're aware of it, because suppose you are, canned tuna fish, so wait a second, let's knock that out. Can we help? And then the thing too is, maybe you just got to get retested every so often to see how you're doing. All of a sudden the symptoms come back. Well, then, you got to back off again. it comes down to taking care of your own self. Easiest takeaway I would do is like reach out to Cyrex, cyrexlabs.com. Find out if the provider in your area will take the blood, or they'll send you the kit. You take it to Quest or LabCorp, or even Yale around here, Stanford Hospital, all these different centers. They'll do the blood work and they send it out for you. So it's not impossible, but if you're interested, this is probably the first step. Take the damn Alzheimer's Linx test for Alzheimer's related dementia stuff. To that end, have a wonderful, happy, healthy Thanksgiving. I'm Dr. Brian McKay, not just a chiropractor, Stanford, Darien, Norwalk, New Canaan. All right, call me with any questions, 203-656-3636. Bye.